Thanks, Gary, for very strong advocacy on indeed the services, particularly for women and mothers, as you've described, and particularly the requirement for specific interventions, and also the huge issue around stigmatisation that happens, particularly even more harsh for women. So thank you for that, Gary. Okay, can I now ask Catherine Kenny to join us? Catherine is the CEO of Dublin Simon Community. People will be familiar with Simon Community all across the country in terms of the work they do for people suffering homeless and people being vulnerable because of that and the issue of drugs. So over to Catherine. Thank you.
Thank you very much, and thank you very much for the invitation to speak today. It's daunting, but it's incredible to get this opportunity. I'm here today to represent the contributions of those of people experiencing homelessness, who have that lived experience, to represent the volunteers and the staff that have contributed to our services over the last 54 years, and to give details of our primary research conducted within our services by Catherine Comiskey and our team in Trinity College on the recovery journey, and Ivana Maloney on lived experience of adherence to HIV medication in the context of homelessness and addiction. With over 12,000 in homelessness, we are in a crisis. Homelessness has a profound effect on a person's health, as evidenced by the lower life expectancy. And addiction is a key element in this. Sometimes addiction will take everything, and you will find yourself homeless. Other times you become homeless for other reasons, and then end up mixing with people on the streets, in hostels, who use everything, and then you will get addicted. Speaking of this group that client was in, they highlighted that 2 of 5 in that group had not used crack cocaine until they entered homelessness. In 2022, drug use was the second most commonly cited original reason for homelessness across our emergency accommodation. Clients frequently present with complex multi-morbidities involving physical health, mental health and addiction, all of which are completely interdependent. Polydrug use is common, such as using both crack cocaine and benzodiazepines. The vast majority of referrals to our addiction treatment involve multiple types of drug and alcohol. Due to children and family responsibles, as has been evidenced, women often experience distinct barriers to addiction treatment, and often that delays their seeking support until crisis point. Addiction recovery looks different for every individual client that accesses our services. Therefore, autonomy and empowerment are key elements of our approach. Across our wide range of services, from outreach through to independent housing, we use a range of approaches to make sure that we implement harm reduction and abstinence-based programs. Some of those include the We Will Survive, Reduce the Use, Seeking Safety, Community Reinforcement Approach, Motivational Interviewing, CBT, Education on Addiction and on Homelessness and Health. To overcome personal stigma and shame, while it can sound nebulous, can often seem too simple and can be easily overlooked. We underpin all of our models and approaches with the principles of a non-judgmental approach led by client choice and control, kindness, compassion, and placing emphasis on building trusting relationships, providing a safe space, meeting the immediate health needs of the individual so they can shift their focus onto their health and their well-being, and always positively reinforcing and building esteem. As one of her clients in Respite said, Respite was a place where she could get warm meal, a bed, but it was also a place where her soul could take a breath. It is critical to support people to navigate the pathways and hurdles that exist in trying to access further treatment. This increases their independence and confidence so that they do not develop a reliance on our services, but can leave confident in the fact that they can deal with any challenges they come up against into the future and know when and how to seek supports. Every day we work with people who are looking for help, who are meeting endless waiting lists and barriers to services. To address these gaps and barriers, we have, since 2003, delivered homeless-specific treatment services. In 2022, 934 clients accessed specifically our clinical and therapeutic services. In 2014, we commenced plans to deliver a 100-bed health and addiction treatment facility on Ushers Island for those experiencing homelessness, which with the support of the Department of Housing and Health, will be opened next year. For us as a country to develop and address the issues of addiction and homelessness, we need to address 3 key areas: prevention, deliver tailored services, and create opportunities for stability. When it comes to addiction and homelessness, prevention is definitely better than the cure. For a score of 31 to 33 is sufficient for a PTSD diagnosis using the post-traumatic checklist. The earliest stages of our recovery services, clients are presenting with a mean score of 41.9. In 2022, across our participants in the recovery services that had gone through them, their mean score was then 30.5. So services can and do make a difference. What's striking is that in this group, less than 10% of people reported no childhood trauma. It is critical we fully tackle and resource prevention and early intervention, tackling trauma, poverty, deprivation. This will need to include psychological interventions, education and health awareness campaigns in schools. We need to break this cycle. Delivering tailored services. As Tony said, there's no such thing as a hard-to-reach group, only hard-to-reach services. Our clients encounter loads of barriers and health supports, but there are no barriers to drugs. When services are closed or out of hours, drugs are still there. Overdoses and mental health crises are still there. In fact, drugs have never been more accessible. Our clients can use Snapchat and have drugs delivered to your door quicker than food. We need to ensure that we are consciously aware of these emerging trends and the needs of those accessing them. The research on a recovery service shows that in phase 3, clients have fewer physical health symptoms, lower anxiety, better social functioning, better psychological well-being, including self-confidence, goal setting and self-efficacy. Stability is critical. It's not just access to services that it is required, but housing security and fluid long-term supports suitable to needs. Insecurity has a huge impact on any person.
Just a minute or so, Catherine, if you can, please.
Pardon?
Just another minute or so, if you can. Yeah, thanks.
I know one of our clients said, "I know that I have 6 months left, but I'm really traumatised by the prospect of being homeless again. It's all I think about. I'm not sleeping, and I can't believe I've worked this hard, and it could all disappear." In a study of adherence to HIV medication in the context of homelessness and addiction, clients had significantly better adherence to medication during periods of stabilising, not necessarily abstaining from their drug use. Stability matters. As one of our clients said, once you have a fixed address, you have a base and you can work on everything else. We need to take action. There's a lot of talking and policy making, but there's no time to wait. People are dying and families are affected every day of the week. We need to invest in prevention, investment in early intervention and prevention, youth education, family mediation, community supports. We need to tackle poverty, deprivation in disadvantaged communities. We need to deliver services, be innovative, to move away from archaic notions of recovery as defined by abstinence only. We need to create opportunities for stability, deliver safe, secure housing for people with responsive community support. It's critical that we do remember there are successes happening. Our task is to prevent more people entering the system and support those currently in homelessness and addiction through their experience so they can go on to live full, meaningful lives. Thank you for your time and attention.